In September of 2006, the American Chemical Society presented a Heroes of Chemistry award to 3 industrial chemists associated with Princeton University and Eli Lilly and Company for their joint development of Alimta. This new chemotherapy drug has been clinically proven to affect every type of solid tumor on which it's been tested, including mesothelioma and other asbestos-related lung cancers. Alimta does not cure mesothelioma or lung cancer. However, it does slow the progress of the diseases. It's the first and only drug approved by the FDA for the treatment of mesothelioma for patients unable to tolerate surgery. Alimta causes fewer side effects than many other chemotherapy drugs. It's also easier and quicker to administer. Alimta generally extends a cancer patient's life and improves the quality of that life. What to expect during treatment. Many of Alimta's more harmful side effects can be controlled with vitamin supplements and prescription medications. Before, during, and after each treatment cycle, patients should take between 350 and 1,000 micrograms of folic acid. Patients are also given shots of vitamin B12 several times during the course of each cycle, as well as prescription drugs called corticosteroids to prevent skin rashes and other complications. Alimta should not be taken at the same time as non-steroidal anti-inflammatory drugs such as ibuprofen or other drugs used to treat pain, arthritis, and swelling. This combination of drugs can cause serious complications. Patients should clear all medications taken during chemotherapy, including herbal remedies and non-prescription drugs, with their doctors prior to treatment. Alimta is administered through a vein in the patient's arm by a procedure called IV infusion. This procedure takes about 10 minutes. Many patients, especially those with mesothelioma, receive a second chemotherapy drug half an hour after Alimta, which usually takes several additional hours. Generally, this is an outpatient procedure, so the patients do not have to stay in the hospital overnight. This treatment procedure is repeated on a 21-day cycle, so patients receive chemotherapy with Alimta once every 3 weeks. The number of cycles are determined by the patient's oncologist, who will monitor the size of the tumor and the patient's condition carefully throughout treatment. Even with co-medications, it's possible to suffer side effects from Alimta, as with any other chemotherapy drug. Doctors will perform blood tests to monitor for the worst of these, including anemia and problems with blood and bone marrow. Patients should be alert for fatigue, stomach upset, including diarrhea, nausea and vomiting, fever or chills, skin rash, mouth, throat, or lip sores. If a patient develops any of these side effects, they should be discussed with the medical staff. These side effects could be signs of an allergy to Alimta or require additional monitoring or treatment. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.